right, I've got 1 minute past 11, so I'm going to go ahead and get started. I know we've got folks that will be jumping in here over the next few minutes. So welcome everybody. My name is Kevin Stewart, and we are here today to talk about Zika. I think it's no news or no shock to anybody, but Zika is in fact here, and over the course of the summer and working with a lot of our customers, we've been able to see really firsthand where location technology and GIS can in fact make a difference. We've got a lot of content to plow through this morning, and a lot of good stories to tell. We've got a good agenda put together, so it's going to be a mix of presenters, and I would like to just go ahead and get you guys introduced to everybody that's going to be talking today. So first off, again, my name is Kevin Stewart. I'm the managing partner for our state and local government business unit at GIS Inc. I've been with the company for just about 17 years, and I will be the moderator for today's webinar. Greg, go ahead and introduce yourself.
Hi, everybody. My name is Greg Hemo. I'm the GIS director for the City of New Orleans. We've had an enterprise GIS team for a while, and I've been here since 2011, and we're excited to be partnering with GIS Inc. for this effort.
Excellent. Chris?
Yeah, good afternoon, everyone. Chris Blinn. I'm a solution engineer with the State and Local Business Unit at GIS Inc. And I was a part of the GIS Inc. team that was the boots on the ground effort with the City of New Orleans to help put together some of these solutions, and excited to show you guys some examples of what we did.
Excellent. Thank you, guys. All right, so discussion topics. Like I said, we've got a really good agenda put together, a lot of good content. We're going to start off just with some context on Zika, what it is, just getting everybody on the same page, and where it is here in the U.S. Talk a little bit about why you should care. And then, of course, we're going to tie in some maps to that. What do maps have to do with this, and how can they help? And that's going to really segue us right into the solutions that exist today. There's a number of solutions that our good friends over at Esri have put together right out of the box, and we got them really coming from two teams there: the health team, Health and Human Services team, and then also the solutions team. So looking forward to showing everybody really quickly how you can get out there and access those and learn more about all those information products. And then, of course, Greg's going to walk us through the story of New Orleans. He's going to tell a 15-year enterprise GIS story in a couple minutes. So that's going to be good and exciting. They definitely are on the brink of doing a lot of great things and making location technology pervasive throughout the entire enterprise there. And we're going to tie it into what did New Orleans do as it relates to Zika and vector-borne disease, and what is the plan going forward. So I think there's going to be a lot of good stuff there, and that's where Chris is going to jump in and do a little show and tell. It's always can be a roller coaster ride doing a live demo in a webinar, but we're confident that things are going to work, and Chris is going to show some of the solutions that were deployed there at New Orleans. There is some funding opportunity out there as it relates to health, emergency infectious disease preparedness, and things like Zika, and I want to spend a little time sharing some of those sites to you guys to do a little more research. And then we've got this webinar set up so folks can raise their hand, at the end if they want to provide some feedback and ask questions. So I will tell you, we're not going to keep you the full hour. We'll give you a little time back in your day, and then in the middle here we're going to do a little show and tell, and so we think that's going to break it up nicely for everybody. So Zika, all right? So I don't think I need to spend too much time really talking about the vector here. I think everybody knows it's a mosquito, right? We're talking about the Aedes species mosquito. So Aedes aegypti and Aedes albopictus. You see them pictured there in the lower left. The picture on the right is actually, that's my hand. That's an 80s Avopictus mosquito that actually landed on me in my backyard just about a month ago. So these mosquitoes are out. They're very pervasive. You can find them in most states in the U.S. and hence the risk, right? And so the big thing we're talking about here with Zika that makes it different than chikungunya and dengue virus and yellow fever is, we're talking about women, pregnant women, and their babies, right? And that's really the big risk, and what it can do with birth defects, primarily microcephaly, right? And I think that's been well documented. There's tons of information out there on that, but that's the risk here, and that's what we're trying to mitigate, and that's what we're trying to prevent. And I think really as we go through the course of the webinar today, you guys will all see that there's information products out there and available. There's early adopters like the City of New Orleans, and that's really what today's about. So took a screenshot off the CDC's webpage that really shows where Zika is here in the U.S. You can see the dark blue states. These have the most cases. Now, every state except Florida are travel cases. So when it comes to these known cases, we're talking here in the U.S. around 3,900 known cases, and they're all travel-based. In other words, folks that have traveled to a hot Zika zone in whether it's South America or the Caribbean, and come back and have tested positive for the disease. All 137 locally transmitted diseases, Zika disease, have occurred in Florida, right? And it's interesting because here we sit today. It's October 27th, and one of the things we learned in New Orleans was, some people might think the peak season is a July and August timeframe, but the reality is in New Orleans today's almost the peak, right? The October-November timeframe is what the Mosquito Control Board told us is really their peak season, and the other thing to mention is I know the media made that shift about 2 months ago to cover the election, and Zika kind of calmed down in the U.S. in terms of media coverage. Is Zika's not a 2016 issue. Zika's here in 2017. He'll be here in 2018, and it's just something we're going to need to continue to be creative and innovative on ways to be prepared, to control, and to do outreach. So why do you care? Why should you care? Again, this is a disease that's different than some of its. This mosquito vector also carries the dengue virus. It carries the chikungunya virus. So it's the same mosquito that carries Zika, but the thing that's different about that, we're talking about pregnant moms and babies, and the disease, the birth defect, the microcephaly, and it just kind of raises the stakes here, right? And then when you start talking about the folks that are plugged in and involved with mosquito control, you start talking to the folks that are involved in the health department, where they really amp up and ramp up the outreach and awareness and communications, particularly when there's known cases in their respective jurisdictions. You see there's a lot of paper, right? There's a lot of paper in those workflows. There's a lot of duplicate data entry. You see when you sit down with these folks, there's a lot of lag time from field ops back to control, right? And so all that really leads us to there's an opportunity here for technology to kind of plug in and add some efficiencies. And we hear the term a lot. We heard a lot when we were in New Orleans, this evidence-based decision making and just really that true need, right? We all heard the story in South Carolina where they did that mass spray and it killed millions of those bees and other insects, and that's just not how you control. And so there is truly a need for evidence-based decision-making, location-based decision-making. And when you think about it, you can actually trace it all the way back to John Snow. And anybody that's involved in health Anybody that's really involved in GIS knows who John Snow is. He's known today as the father of modern day epidemiology. He was the guy that actually solved the cholera outbreak in Soho, London back in 1854. Here you can see a kind of a snippet of his maps, right, that he put together, the one in the upper right. The thing about cholera, when the outbreak was going on, it was believed to have been an airborne disease. And John Snow, started plotting the affected citizens out on a map and was able to trace it to a contaminated water source. And in fact, it was a result of these maps that really cracked the code there and solved it. And so it's just kind of, anybody on the phone that's GIS based, I'm not telling you anything you don't know. I mean, a map is just worth 1,000 pictures. You're going to see trends. You're going to see things that you don't see in any other venue. And today it's no different when we talk about vector-borne diseases. And the only thing that's different is the technology, right? The technology's changed, but what insights you can gain from that map can in fact help you crack the code and solve problems and be more prepared and be more efficient. So that's really the bottom line up front, is that location technology can in fact play a critical role in supporting the Zika and all vector-borne disease mission. And so when we talk about that, there is a platform out there. We've all probably have set in some form or fashion a seminar from Esri or a user conference, and we are all well versed in this platform called ArcGIS platform. And the big takeaway is that, hey, this is a platform that allows you to combine spatial and temporal workflows, right? So you can in fact then make the evidence-based decisions, and you can in fact make what we're calling the location-based decisions. And our good friends at Esri, like I said, they've been hard at work over the last year. One of the things they've done a really good job of in the last 7 or 8 years is putting together a collection of information products for local governments. And really this year was the year that we really saw them pour some energy and resources into some of the information products that are available for health departments. And they've got this, and I encourage everybody that hasn't been there to go out to the website go.esri.com/vector-ready, and you see the URL there, and get a glimpse into really how quick you could turn around some solutions designed to support it from a health perspective, support vector-borne disease from a health perspective. There's a lot of great information out there, a lot of ways to get started quick. Another resource that everybody should jot down is they got a good example of what a model health organization should look like, and you can take a lot of these templates, a lot of these information products for a ride on your own. They're all interactive and all up and running. So again, capture that URL there and take it for a ride. There's a lot of tools that you'll be able to navigate through and kind of get your hands dirty, just walking through on your own. And then the third gallery I'll talk about and resource for you guys is really Esri's Solutions Gallery. So this is a gallery from the Solutions team. If you go to that URL, you're going to be able to search. I would encourage everybody just to do a single keyword search on mosquito. If you did that, you're going to actually retrieve the 9 information products that were designed by the Solution team for mosquito control. So in essence, there's just over 20 information products that Esri as a company have put together, some from the health team, some from the solutions team, that all can work in concert as a repository, or think of it as a quiver of solutions for your local government. And that's really kind of what led us into New Orleans. we've partnered with the City of New Orleans for the last few years. We've got a really good partnership with these guys. Greg and I were talking, and he kind of educated me about this data-driven mission that the city's on, and they're a leader when it comes to this evidence-based decision making. If you think about local governments, their biggest corporate asset's data, and so New Orleans, they get that, and they want to use that data to make good business decisions, and so the timing was really good to kind of start talking about what we could do as it relates to Zika. So Greg, you want to go ahead and jump in and kind of walk us through what we did at New Orleans?
Sure thing. Thanks, Kevin. So yeah, we've been taking this data-driven approach informally for a few years now, but formally late this summer we launched datadriven.nolo.gov. You can go to that website to sort of experience a bunch of different applications across government. You can go in there. There's links to our open data portal, and you can also see a little bit more about GIS. So just a little bit of background that is relevant to this Zika discussion is, so of course we're pretty close to Florida where there's some actual transmission going on. We have about 10 million visitors per year, and about 1 million of those are cruise line passengers. So we've got to be careful, and then of course, with our humid subtropical climate, it's pretty mosquito friendly around here. Kevin was asking me if I ever swatted one of those species of mosquitoes and noticed it on my hand, and if I had taken the time to look at the species, I would have missed the one that was biting me in my ankle at the same time. So it's something we wanted to be proactive about. So our enterprise GIS team is nicely situated, close to our web team and other data teams that are really working through some things. So you can see through our sort of splash page, if you will, at gis.nolo.gov, a lot of the applications that we've been rolling out. So some of these are built in-house from the bottom up. Others are sort of taking an Esri template and changing it up just a little bit to suit our needs. But there's a lot of needs out there, and we're sort of trying to move on from the past where governments would have sort of a kitchen sink viewer where it tried to do everything, sort of like a little small version of desktop, But we need something that's much more user-friendly than that. We've also had the opportunity in the last couple of years to work very closely with the local government solutions team with Esri, and so some of our work has paid off with that, and we have some basically internationally available local government apps that we've helped to influence and help to build with that team. So it's really all about collaboration. As I sit as the Enterprise GIS Director, that could be interpreted a few different ways, but what it really means is I've got to lead the collaboration between a lot of different departments. And as it comes to Zika, that mission itself to fight Zika and prevent Zika spread across our city doesn't just fall on one department, right? It falls on our health department, it falls on our mosquito control, and both of those departments already have to collaborate with the state and the state through the federal government. So these two departments, particularly health and mosquito, GIS wasn't a foreign thing to them. They were already involved with GIS, but they weren't really using GIS yet to do the sort of things that you can do to be proactive about the spread of Zika. And when those sort of organizations get some extra funding, they quickly have to spend it on overtime. They're not going to get to hire people really quickly to respond, and basically the chemical and the methods to actually do the treatment. So as Kevin mentioned, we've been working together for a few years now, and the timing was sort of just perfect because he showed you, and he's going to show you some more, how some of these Esri solutions are sort of coming of age, and they were coming of age at the right time when we sort of needed them. And so is our enterprise GIS, and so is our city when it comes to a data-driven approach. So really what we did is we put together sort of a few days where the GIS people, the solutions engineers, and other experts who are familiar with the spread of vector-borne diseases. We really sat down with the subject matter experts in our health department, in our mosquito control, and it was sort of another thing that was perfect timing about this was, this was in mid-June. A lot of the ramp up and the excitement, if you will, about Zika was pretty active right then. And they were the combination of efforts from health and mosquito were about to hit the streets to do outreach, literally going door to door to educate people about what they can do to control mosquitoes in general. And while they were doing so, they were going to be out there documenting conditions where they saw mosquitoes are breeding or could breed. And that was all going to be done on paper. So the timing was right, and usually you go through this assessment, you provide a document, and then you start using or building apps. Because of that urgent need, the critical need, GIS Inc. and their team sort of identified and spun up a collector, an ArcGIS collector-based application that could be used basically right away. So, Chris, can you sort of walk us through that?
Absolutely. Thanks, Greg. Let me go ahead and get my screen up and running here. While that's loading, I'll help set the stage for this collector application and exactly what was going on with our meetings we had on site while we're in New Orleans. You can imagine, and I'm sure many of you have been in those meetings, you've got everyone sitting in the round table, you're throwing out ideas, and it was brought up about the Health Corps, this large volunteer-based program that New Orleans sponsors to go out to, as you can imagine, they're in the large parish, they have many neighborhoods, and so it takes a large effort to get out there and collect this information. But they told us, yeah, we got papers that we're going to fill out, and there was different sets of papers for different types of groups, and it just didn't sound good. It not only is it hot in mid-June in New Orleans, but the rain comes, and so you can imagine the effect of loss of information when you're working with paper-driven products. So while we were sitting in the meeting, we were listening to all the different types of information they were collecting, and right there I started just putting together a data model for a collector application. And I think this really drives home the power of these types of solutions. In literally about an hour, we had a prototype in collector working. So that's a real good message to send here. It's not something that takes months of effort like it used to have done to create a mobile application to take away your paper needs. So that's an important thing to keep in mind. So hopefully everyone can see my screen. I'm actually emulating my phone onto a browser so you can see this collector application that we put together. It shows the parish, and New Orleans and their health corps has done a fantastic job of going out throughout the different areas collecting this inspection data. And what they're doing is when they get into the different neighborhoods, they start completing one of these inspection forms. I'll show you the details of some of the information they're collecting. They're taking information down of what type of properties, the contact information. They're collecting a lot of relative information related to containers or potential containers. As you can imagine, mosquitoes could care less where water sits as long as water's sitting there. That's the breeding ground for them. So a lot of the health corps is going out and trying to identify what is a potential container. But all this form-based information is getting filtered back along with additional reports of treatment and images, so decision makers can make effective decisions. That goes back to the evidence-based decision making. So they're not going out on a whimsy trying to figure out how they're going to conduct their treatment efforts. They're using all the information they're collecting at hand from this collector application to be effective and make sure that their eradication efforts are working. So it's one level to be able to have this type of product taken to the field and start collecting information on. But we also thought that there was a need then for the people back in the office, maybe perhaps some office stakeholders or department heads, to see the collection efforts and make some decisions right from there. So we also put together this dashboard. Let me zoom out here so you can see the entire parish. There's been a lot of work done since the mid-June when we first rolled this out, and you can see that from this map. But one thing I think that really sends the message home and really depicts the story is this number right here. Just excuse me 1 second, let me refresh this page. But within the map, you can understand that there's various types of information. For instance, the tires that were collected. That's information that can be directly sent to waste control to say, hey, we have tires that are in this area. Make sure you pick them up. If there's areas of large amounts of pooling from perhaps runoff into the streets, that's something that the street department can get out there and see if there's anything wrong with like the catch basins being clogged up or something like that. But the big number I want to show you is this right here. Over 4,800 inspections were done from a volunteer base. And if you all have your own collection efforts or departments out in the field trying to collect that type of information or think that it's not possible, I think it's a really important message to say, hey, look what was done here. And this is just a continued effort from the city of New Orleans to strive and collect even more information to help with those decisions of eradicating the species. And with that, I'll throw it back over to Kevin.
Thank you, Chris. And we got through that with just some minor glitch, so that's good. I'd say that's success for a live demo. No, really appreciate it. Just tie a couple things together there. I think everybody picked up on it, but when we were on site, we learned that the city had put together this health core, and that's really where we talk about this concept of using citizens as sensors, right? The big data movements here, and that means there's sensors out in the field, but citizens can also be sensors, and they can also have a hand to play here, and that's really what we saw. And 183 volunteers hitting the streets in a week from when we were on site. And as Chris mentioned, just the power of what the platform we can do today is within an hour we had a prototype that they took out, and we went through 2 or 3 iterations and ultimately just got it scaled and configured to what they needed. And we're talking about 183 volunteers that none of them could really spell GIS, right? And so just in a 5 or 10 minute training, they were able to install the app on their, whether it was an Android or an iPhone, and instead of going out in the field with a clipboard and pen, they use their smartphones, and there was no duplicate data entry, and all that information is being funneled back into the dashboard that said, hey, here's the containers, here's the standing water. The dashboard just is beautiful in terms of cutting that data and making it meaningful to, as Chris alluded to, the decision maker. So getting back to the business process review, when we organize the deliverable, and we're going to step through the recommendations here real quick in these 3 core functional areas, right? And that's what you see as monitoring and surveillance. Really when you take the mosquito control board and you take the health department, their workflows all kind of funnel into these 3 functional areas: monitoring and surveillance, control and treatment, and outreach and education, right? So we're going to step through. I want to show just the solutions that we recommended for each of those functional areas. So monitoring and surveillance, you guys can read the goal here, but bottom line, it's all about, we need to locate the presence of these mosquitoes, and we need to also locate the location of where the highest risk areas are, right? And inevitably, you get a bunch of folks together that love what they do in terms of mosquito control and health and GIS, and you come out with what we think is really what we ended up calling the Holy Grail, and I'll talk on that. It's the risk profile. But here you can see the solutions. It starts with what Chris showed you in terms of the risk inspection, the collector and dashboard app. Also, another app that can be used for using citizens as sensors is that service request service manager app. This is one that we didn't recommend in that first phase for New Orleans. It's one that's in a latter phase, primarily because there's a tie-in with 3-in-1, and there's some things there that, in terms of upgrade and new environment with that platform, that push that thing back. But that service request is absolutely a place where citizens can engage and document, kind of that from a citizen sensor standpoint, mosquito presence, standing water containers, that kind of thing. Mosquito surveillance and charts, so you can, from your traps, you can start to see some trends over time, based on population counts by species, and there's some really good tools there for that. And then we thought a common operational picture would be good, because there's, if you read the New Orleans Zika plan, there's 10 departments involved. So who picks up those containers in the yard? Is that code enforcement? Is that sanitation? So a need for a cross-departmental common operational picture that, again, can be configured to each department's view of what they need to see to make decisions. And then finally, this risk profile that I already kind of foreshadowed. This is what, Greg and I and Chris have all really called the Holy Grail, and the image there kind of illustrates what we're talking about. Imagine, that, basically the bottom line, that red is, you need to really get serious about controlling that. The things that's going to be red and orange are, hey, this is not only where mosquito presence is, this is where we've detected the virus, this is where we have a known case. We've got, and you couple that with, we've got standing water, we've got containers, that's high risk. And these are areas we really need to pay attention to and control. And this is a dynamic breathing layer that we just called the risk profile, right? That gets updated daily based on the risk inspections, based on what they're pulling back from the traps, based on, the evidence in the field. And this is something that can really steer and help make good decisions on where we need to control. And I think it speaks loud and clear. There's definitely some hot spots here, right?
Yeah, having a risk profile like this is sort of the ultimate, end goal when you want to be proactive. You can't be everywhere. You can't trace every mosquito with a sensor itself, right? So this is the next best thing, really. We'd love to have it one day.
All right, the second core functional area was the control and treatment. And so like you would think with the title, control and treat, this is where we control a vector. Mosquito control case, it can be a mosquito, termite, rodent. And I'll mention this at the end, but I'll go ahead and foreshadow it here. We're talking Zika, but these tools apply to any vector-borne disease. And I'll reiterate that at the end. But so some tools ready to go, right off the shelf solutions that we saw great plays for down at New Orleans in terms of their workflows. They're out there doing adulticide, larvicide planning and treatment. Well, there's tools, there's actually applications ready to go that support that entire workflow. Keeping track of your mosquito spray areas, where you sprayed, when you spraying next week, and then communicating that out to citizens, right? And maybe you have no spray zones for whatever reason. Maybe there's, health risk or health concerns. They can't be around that chemical, which does happen quite a bit, actually. Health concerns editor. Where are our health concerns? Where have we detected, whether it's a vector that tested positive or a known case. Now New Orleans, the state epidemiologist is really the only one that works with an address or down to the address level or XY. But for communication purposes across departments, they can communicate a 100 block. But that 100 block still is valuable information to know that we have a known case within this 100 block, and that should drive some control activities. So we had four recommendations for control and treatment. Greg or Chris, anything to round out?
Yeah, absolutely here. I think another key thing to keep in mind is, just referencing back to that risk profile, is all of these solutions are pieces of information that are going to generate data that is going to be consumed by that profile. Everything has a percentage of role. And working with local epidemiologists where we deploy these solutions, we're fine-tuning that algorithm. And so it's just a real scientific process that is going to deliver on that evidence-supported decision making. And I think that really this control and treatment phase, it may not appear as glamorous as some of the other solutions, but it's perhaps one of the most important when it comes into the control efforts for jurisdictions to make sure that their efforts are being effective.
Yeah, I've been with the city just over 5 years, but I did get to know our mosquito control group almost 10 years ago, and dealing with those mosquito spray areas, managing that way, that's how they work already. So it's obviously location-based, and the fact that these sort of things are easy to roll out for them now is going to be a big win in the near future.
That's right. All right, the third and final functional area, outreach and education, and this is really where we get into educating the citizens and outreaching areas. Really in the end, infectious disease, I mean, there is a good opportunity, a great opportunity for education and outreach. And the ESRI platform, the information products that are out there and available really give us an opportunity to do it in a fashion that really makes sense to everybody. Of course, I'm biased. I think you can probably tell any story from a map, but you look at some of these information products, the My Healthy Services, that's all about helping citizens locate, hey, I live here or I'm here. Where is the clinic? Where is the hospital that has the equipment that I need? Or where is the pharmacy? Right? So it's just a really good configuration that gives meaningful information. The health concern summary. So just communicating with citizens where the concerns are within their local geography. The event planner, that came in as far as a recommendation because, I mean, we all know New Orleans, right? They have a festival or something going on every day, 365 days out of the year. There's something going on. But this is important because what happens at these festivals or these events? Well, it's a big conglomeration of people in a very confined space, typically in an outdoor park or amphitheater, and so that definitely factored into some of our recommendations because just imagine if you're able to overlay this with that risk profile we showed, and it definitely can help make good control and management decisions. So, and then of course the story map, right? These story maps are so powerful in terms of doing that educating and communicating, and it's just a good way to get information out to constituents, get information out to citizens. So lots of good information products here for outreach and education.
I think just an extension of that idea with the story map, I remember we had the conversation while we were in New Orleans. We're staying at our own hotel. We don't live in the city, but how great would it be for, and it was mentioned earlier, if a large visitor base and travelers for cruises and things like that out of New Orleans, how great would it be for them to be able to pull out their smartphones and see this QR code right there at the hotel lobby desk saying, hey, scan this for the latest health updates for the area. And so you're breaking the barrier of information that perhaps people aren't able to obtain currently because they're not watching the news or they didn't read the paper today, but everyone has a smartphone almost, and if we can get this information to all those different portals as easy as possible, I think that's where all of this work is most effective, getting the information out to everyone that needs it.
Absolutely, and the event planner solution is interesting, and to make it real, you've got to be careful to wire the application with meaningful data, and we're just being able to do that really well. We get a lot of information about the location of all sorts of big and small size events now, so that having that data wired makes this application even more meaningful.
Excellent. All right. Thank you, gentlemen. So funding, what's out there, what's available? I'm doing a golf clap right now for our Congress for unleashing some funding about 60 days ago, 45 days ago, and it's probably only about 4 months too late. So I think that's record time for them. But the good news is there are some opportunities out there, and I wanted to point folks to, I found this off the grants.gov website. You can see that long URL there at the bottom, but there is actually an open grant that, solutions and technologies that can go toward really Zika preparedness, response, and control, and any vector-borne disease, and any preparedness or emergency support, disaster support. It's due November 11th, so we got a little time here to put something together. I wanted to point that out, and then also on the CDC's webpage, which I included the URL at the bottom. I just showed kind of a snippet of the states that have received funding from the CDC, and go out there and find your state, and really the action is, hey, we get a call with your state epidemiologist and see if there's an opportunity to get creative in how we might get a project done. So some good resources here, some good funding resources. Go take a look at them, learn about them, and just can't get something going. So three things to remember, right? Obviously, we all know Zika's here. That don't need to beat the dead horse there, but Zika is here. Three things to remember. First of all, what we're talking about with these solutions and location technology, it can come in and it can absolutely help with Zika, but it applies to all vector-borne diseases, right, and/or outbreaks. So these solutions can be scaled. They can be configured to work in any of those settings. The other thing is, and I've said it a lot, is they are scalable. We saw it firsthand in New Orleans, right? We started with something, Chris wired up in 30 minutes, and I don't know, Chris, 3 or 4 iterations later, right? You scaled it to meet the needs they had as being in the field and getting that information back, and so it is absolutely a scalable solution. And most of these solutions are designed not to replace workflows that are in place, but to really streamline them and make them more efficient, and ultimately providing that decision support, so evidence-based decision-making possible, and what we've termed or coined through our process here with New Orleans is location-based decision-making. And as promised, we did not take up a full hour. I do see there has been one question asked in the webinar here, so let me pull this. I got to go back up. Actually, there's been a few questions here, so let's see if we can't get these. All right. So, and we'll go ahead and field these questions. I'll go ahead and move this over here so you guys can capture the contact information for myself and Greg and Chris if there's things you wanted to ask outside of this. So if we wanted to deploy multiple information products, let's say 8 to 10, how long would it take to deploy? It's a very, very good question, Ms. Lori. So, it turns out we've been able to kind of package these things up differently, right, through Jumpstarts. There's an engagement we're going to do that will, in fact, deliver a 9 information product deployment in a week or 2. So within a couple weeks, you could be up and running with 8 or 9. That's the power of those information products. If we really think of them as what they are, let's get these stood up, the starting points, take them to the field, and figure out what we got to tweak and tailor. So 1 to 2 weeks, Lori. And I think next question, what is realistic time frame? Same thing. I would recommend, just like we did down at New Orleans, let's phase these things in. Let's do a phased implementation. So let's do 8 or 9, and let's do that in a week or 2, and then let's step back and let's get those things adopted and come back in. Next question, can you discuss the risk profile more? We've been trying a similar idea in Los Angeles County. Happy to. It's one of those things where when we got into this, the business process review, that was the one information product. There's not an information product out there. We spoke to Esty and Ken on the health team. We spoke to Scott Ottman on the solutions team, and they're very much interested in doing something like that. But it's one of those information products that came out of that business process review where, like, wow, we need this risk profile that is being updated dynamically on a daily basis based on all the inspections, based on all the information coming back from traps, and it is possible, and what we put together is possible. So Chris, I don't know if you want to elaborate a little more on kind of the tech side of it, just a little.
Yeah, absolutely. So the overarching idea is to essentially quantify all of our evidence into a repeatable algorithm that would then generate our results of where to identify risk. And to do that, we're working with epidemiologists and other subject matter experts because we want to really come up with a standardized profile algorithm that can be applied in multiple areas. And we understand that there will be variances from place to place due to some of the input variables. You think weather is different in places, and that has an effect. Different situations with the layout of the land, more water in the ground, things like that. And so we're accounting for essentially hundreds of different variables in different ways, and that's the back end process for that. How that risk profile will definitely produce results that will be effective.
Yep, and you see our contact information there. I would just go ahead and ask that you hit us up, and let's explore that a little bit. And we can get into some of the details on that. So next question: do I need to have GIS expertise in my organization? A very, very interesting question, right? I think to get something deployed and rolled out and using, you don't have to be a GIS expert, right? But long-term, kind of the long-term vision, the most successful organizations implementing this technology we see does in fact have a GIS plan. But I want to make it very clear, right? Let's go back to the example we had in New Orleans. 183 health core individuals can't spell GIS, and in 5-10 minutes they're out in the field using this inspector app on their smartphone. And I think that's true with most of these information products. Once those are stood up, people will be using these solutions. Folks will be using these solutions and not even know really they're in a GIS. So use it from a using standpoint. Don't have to be an expert. And I think that speaks to the next one. How hard is it to learn? I'm kind of reading these questions on the fly here. How hard is it to learn to use these tools? I think the example I just gave just can answer that. Greg, I don't know if you want to, from your perspective, what do you see with some of these information products and the learning curve?
Yeah, I mean, a lot of these things are, if you're familiar with ArcGIS Online, you can start to, roll out through their web app builder some of these simple widgets, and it's important to, when you get into that, to realize what you do know and what you don't know. Having some help with a firm like GIS Inc. is, you can emerge from an experience with them with more information than you started. And what I mean by that is simply knowledge transfer. By learning how to roll out some of these things in your organizations, if you haven't done it yet, you gain the knowledge of how to roll out other types of applications for other solutions. So it's really beneficial that it's sort of like a springboard. If you're not an expert, if you haven't done a lot of these applications, you don't need to be afraid of it. It's sort of easy to dive in.
Oh, that's good. And so I'll answer a few more questions here. We still got a little time. What other cities are using similar tools? What other local governments are using similar tools? Well, I can tell you guys that we've been working with several local governments on looking at adopting some form or fashion of these tools. I think, Chris, you went down to Santa Rosa County to help them get going with ArcGIS Online, but it turned into how do we respond to Zika sort of a week for you, and you ended up rolling out, I don't know, 5-6 information products for Santa Rosa County, Florida last summer. We're working with some folks down in the Tampa area as we speak. on rolling out some of these information products. So very popular down in Florida. We've had conversations up in Virginia with our customer up there, Roanoke County. We've had a lot of good conversations and moving things forward in Texas with Harris County, and I know they're an early adopter, and I know there's some early adopters out in California too, Orange County being one. So there's a lot of folks embracing the technology, and I think it's one of those things, right, where let's look at what's out there and available. We know there's a need. So what do we got to do to kind of start plugging in some of these holes? Let's see here. Is there training available? Yes, there is in fact training available. Some of those resource sites I sent you to for Esri, Esri's got together some good some solutions and some training. Greg mentioned how we like to work in this kind of knowledge transfer, kind of cheek-to-cheek sort of thing. There's a lot of opportunity from both Esri us to get folks trained on how to use and how to expand. So yeah, please take a look at some of those resources I had in here. This is being recorded, so you'll have access to the webinar after the fact, and you can see the URL here on the screen. Zika.gisinc.com is where we'll have the webinar posted. Let's see if I can answer just a couple more here. If we don't have an Esri platform, do we have to go through Esri first, or can we use your services to get that in place, support the solution? Well, yeah, so let me start by saying what's required, right, to roll out these solutions. At minimum, you're going to need an ArcGIS desktop license, right? So basic license of desktop, and once you have that, you're going to need ArcGIS Online. All of these information products can be rolled out online. Data can be housed up there. So it's a very low-cost way from a software standpoint to get in. Once you have that, then you can go down the path of either do it yourself or partner up with someone like us to get you started and do the knowledge transfer so you can take the ball and run. So yeah, very minimal investment on the software side, and it is required. You need some level, and that level being desktop and ArcGIS Online. Yes, there are some tools from Esri that you can use to get you down a path for that risk profile we talked about, the predictive analysis tools that exist. There's a lot, as this comment said, there are a lot of ways to do it, absolutely, and the key there is how do you do it in the fashion to make sure it is that dynamic, living, breathing layer, right? And that's really where you're going to get the biggest bang for the buck. And some other counties and local governments, that have embraced the platform. Maricopa County, Arizona, Hawaii, the state of Hawaii, down in the Florida Keys, Broward County, Volusia County, just to kind of round out what I had thrown out earlier. So, there are a lot of local governments looking at this platform to jump in and support. I just joined the presentation. Is there another presentation? Yes. So I'm not going to give the presentation again, but the good news is this is being recorded. So again, on that URL that you see on the slide, that zika.gisinc.com, you can go to that. Later today, definitely by tomorrow, it will be there, and you can listen to it again. I probably won't listen to it again, but please feel free to listen to it again yourself. Esri online training is now free. It is in fact now free. So you want to get some of the basics, some of that core foundational knowledge on ArcGIS Online, right? Which I said is really the primary platform that you can access that online for free. So. I think I've scanned through most of these questions. With that, I'm going to go ahead and say thank you. Thank you all for attending. Thank you for your attentiveness. We had everybody that jumped in, I think, stayed the full time, and that's great. And again, if you have any questions, please hit myself up or Greg or Chris up at those email addresses, and and we'll talk soon. Thanks, everybody.